Hello and welcome to the New York NYEE Infirmary of Mount Sinai, and thank you so much for choosing us to perform surgery on your child. We perform more pediatric procedures than any other hospital in our health system, and from these experiences we've learned that children tend to feed off of the energy of their parents. So the more relaxed you can be, the more relaxed they'll be. This video is a snapshot of how you'll spend your day at America's oldest specialty hospital. When you arrive on the morning of your surgery, you'll check in at the security desk. Make sure you have a photo ID for everyone in your group. Then they'll direct you to the first step in our process, admitting.
Welcome to admitting. When you see this desk, we will sign you in. We'll ask you to have a seat and wait for us to call your name. Once we call you, you'll follow us back to the cubicle to meet your patient coordinator. Your patient coordinator will review your insurance information, your government-issued ID, and your child's medical history. If your insurance requires a copay or deductible, you'll pay it at this station. We'll put our ID band on your child's wrist or ankle. We'll do that for up to 2 family members. These should be placed on the adults who will visit the child in the recovery room. It's your passport to move between floors. Once that's squared away, we'll hand you your child's chart and send you up to the next stop, the pre-operative floor.
Welcome to the Pediatric unit. When you arrive to our unit, please hand us your child's chart to any of the nurses here at the nursing station. We will then direct you to one of our 2 waiting areas. These waiting areas are stocked with iPads, televisions, coloring books, and toys to help you pass the time. We kindly ask please no food or drink in this area as all the children are fasting for surgery. When we're ready for you, a nursing assistant will come to the room and escort you and your child over to the exam room. This is where we'll be taking your child's height, weight, blood pressure, and temperature. You and your child will get hospital pajamas and socks, and once your child is changed, you will return to the waiting area. The next step of the pre-operative process is led by the pre-operative nurse. The nurse will bring you and your child to a private area to discuss your child's medical history and surgical history. We will also discuss your child's medications that they're currently taking, any allergies, and any other pertinent health information. We will also make sure we have your contact information, including your cell phone, so we can reach out to you throughout the day.
Hi, my name is Dr. Scott Horn, and I'm one of the anesthesiologists here at New York NYEE. I'm here to walk you through the next step of your journey. When meeting with your anesthesiologist, there's some very important things that I want you to keep in mind. Firstly, your anesthesiologist is going to be very interested in finding about any recent respiratory illnesses your child may have had at home. Secondly, your anesthesiologist is going to ask you about any previous anesthetics your child has had and what worked and didn't work when they went to sleep in the operating room. And finally, we'd like to know about any allergic responses or any adverse reactions to anesthesia that yourself or any family members on both sides of the family may have had in the past. We'll examine your child and then take our time to discuss in great detail the anesthetic plan for today. Please be honest about any recent respiratory illnesses when discussing your child's history with your anesthesiologist. We know a lot of time and planning goes into the day of surgery. However, we're the experts on what's safe and what's not safe in the operating room. Sometimes respiratory illnesses, if they're still lingering or they've been recent, can cause your child unnecessary risk in the operating room. We'll be the best judge of that.
After meeting with the anesthesia team, you and your child will be brought back to the waiting area. Once the OR is ready, a nursing assistant will escort your child and up to 2 adult family members to the OR holding area.
Your child's surgeon, anesthesiologist, and an OR nurse will meet with you in the OR holding area. The anesthesiologist might be different from the one who interviewed you upstairs. This is common, and no matter who it is, you're in good hands. The anesthesiologist will recheck your ID bands and confirm the type of surgery. This is the time to ask any additional questions about anesthesia or what to expect in the operating room. When your child surgeon comes in, they might mark your child's skin. This is important as it tells them where they are operating. When everyone is ready, the OR nurse will escort your child and one parent to the operating room. You are welcome to bring an iPad, cell phone, or other tablet device for your child to watch as anesthesia is administered in the operating room. If you'd like to do so, grab it now, because you cannot return to the OR holding area once you're escorted to the operating room. Keep in mind, a lot of children become anxious or afraid on the way to the operating room. This is completely normal. In our experience, the parent is the best person to talk to the child and to try to calm their fears. If parents look calm, children are more likely to follow suit. Safety policies allow one parent to be in the operating room as the doctor administers anesthesia. If you know that one parent is calmer than the other, it is best to send this parent. The goal is to help your child feel as calm as possible. The parent escorting the child will be given a disposable suit, shoe covers, and a hat to wear in the operating room. The other adult family member and any family members who are in the pre-operative area are asked to wait in the pre-operative waiting rooms or are welcome to go to the cafeteria for the duration of surgery.
Once you come into the operating room, we'll ask you to help us put your child on the operating room table. We'll start putting some of the monitors on. We'll put the blood pressure cuff on the leg or the arm. We'll put some EKG leads, 3 leads we'll put on. They're like little stickers. And then we'll put pulse ox on. One, sometimes it'll be just a clip, or it'll be like a sticky thing that you tape.
For most children under the age of 10, inside the operating room, we'll give them an anesthetic mask to breathe in gases, which means that they won't have an IV while they're awake. If your child is receiving a mask, the gas smells pretty bad. Some people say it smells like nail polish or plastic. We offer a few flavors to cover this smell, but it doesn't completely do the trick. Once the mask is placed on your child's face, it will stay in place until they are completely asleep. Because of the smell, kids often squirm and try to get the mask off. Once they are asleep, they'll receive an intravenous. For most children over 10, we'll put some special cream to numb the skin before they go down to the operating room. That allows us to safely place an intravenous before they go to sleep, and they'll receive medicine through the IV to go to sleep. If your child's process varies, don't worry. Just remember that the plan is tailored to what we've determined is safest for each child. The anesthetic gases may cause your child's eyes to roll around, their breathing might become irregular, and their muscles might become rigid. This is all normal. It's often more traumatic for the parent than it is for the child. Just remember, your child won't remember any of it. You are welcome to have your child watch something on a cell phone or tablet as they fall asleep. It is also helpful to hold their hand, tell them a story, sing them a song, whatever helps them fall asleep. You'll stay until the child falls asleep. Once they're asleep, the nurse will point you to the appropriate waiting room. Once you leave the operating room, you can discard the disposable OR suit, shoe covers, and hat. You're done with these for the day.
The hardest part is over. When your child is safely out of surgery, the nurses will call your cell phone and ask for you to come to the recovery room. 2 adult family members can come to the recovery room. Unfortunately, siblings and other children are not permitted to the recovery room. When you get to the recovery room, you'll check into the front desk, and the unit clerk will escort you to the child's bedside or crib. Remember, they'll check the ID bands. This is a standard safety precaution. We know you want to be here when your child wakes up. Prepare yourself. The child might already have their eyes wide open when you get here. Even if they do, they won't really remember anything. It takes about 30 minutes for memory to kick in, and even if your child seems to be awake, it's important that you pay attention to what the nurse is saying as you get to your child's bedside. The nurse will be giving you an orientation, showing you what the monitor does and what the alarms mean. They'll show you that there's an IV in the child's arm and that this must be in place for a few more hours. Please do not touch this IV. A nurse will be by your child's side throughout the entire recovery process. Sometimes waking up from anesthesia looks stressful. Your child might be restless, their muscles might go rigid, their eyes might roll around. This is completely normal. It's part of the process as the brain safely recovers from anesthesia. Your child will probably be delirious for 20 to 30 minutes. At that point, they'll start to act like themselves again. They might even fall back asleep. The anesthesia team will assess whether your child needs anything for pain. The nurses will let you know when it's safe to hold your child in your lap. And when the child is awake enough, the nurses will begin to offer them clear liquids. After about an hour, the nurse will reassess your child and you will be transferred to recovery phase 2. The timing of this transfer will vary depending on the type of surgery and the age of your child. Just remember, the IV will remain in place until the end of phase 2. This helps us administer medications and fluids as needed until they are ready to go home. So from here, we'll take you to the next phase of recovery.
Welcome to Phase 2 Recovery. This floor looks familiar. This is where your child had their pre-op exams. When you and your child arrive back to the unit, a nursing assistant will then direct you to one of our post-op areas. Here in one of these post-op rooms, a nursing assistant will come in and perform your child's vital signs and offer some clear liquids to drink. The nurse then will come in and monitor your child and also give you surgeon's instructions for the discharge plan. They will go over medications, any follow-up appointments, to help make sure that you keep your child safe at home. They will give you a printed copy of these instructions. Put them in your bag for safekeeping. The nurses will monitor your child for up to 3 hours. Once your child's pain and nausea are under control, and the nurses have determined that there is no abnormal bleeding, the IV will be removed and your child will be discharged. If your child is scheduled to stay overnight, the nursing team will get you and your family settled into a post-op room. Your child's IV will stay in, and the nurse will administer pain medication to help your child remain comfortable throughout the night. One parent can stay overnight with your child, and the surgical team will stop by in the morning to assess your child for discharge. And that's the final step here at the New York Eye and Ear Infirmary of Mount Sinai. When your child gets home, please be sure to give them lots of love, attention, and hugs.
After your child goes home from surgery, you will be receiving a survey from us in the mail. Please take the time to fill it out so we know what we can do to improve, or we can compliment any team members who went above and beyond for you or your child during your stay with us. You know your child best. The better job we do of minimizing or demystifying their day at the hospital, the better your child will do during their stay and will improve their health outcomes. We hope this video helped you feel calm and more prepared for your child's surgery. Thank you again for choosing us, and we'll see you soon. As you pack, here are a few things to keep in mind.